Okay, so hello everyone. My name is Tom, and today I will be
Rafael.
Awesome. And today we will be presenting our solution that tackles one of the probably the biggest challenges that we face in the online space at the moment, and that is misinformation. Now, misinformation is the spreading of incorrect information. Now, this can take many different forms, and many of the world's greatest problems actually comes from this. And so misinformation, its effects are very widespread. The environment, health and well-being, discrimination, and personal development, these four key aspects of our lives are all affected by misinformation. And we knew from this that this is something that we wanted to tackle.
This is how we came to create Check It. Check It is basically a platform that helps people identify misinformation. And as you can see, this is our tagline here, stop, because I know we're all very busy, but sometimes we just need to stop and think about what's around us and what we're feeling or hearing or even reading. And once we stop, let's just think about it, you know? Even if we're not sure, why not check it? We're human, we don't need to know everything, and it's okay to just ask. These are three simple actions that we truly believe that can change the world. And Check It is a platform that simply encourages people to take these actions. And for this to be possible, it relies on two main areas. The first one is awareness and education. We believe that knowledge is the best weapon we have against this problem. And because of this, we want to educate people, not just in these generations, but also the next generations, the ones that haven't been born yet. And this is why our platform also has different resources and activities that aim to educate people about what is misinformation and why it's dangerous for us. Then the second area is the more technical side of it. And we have created a digital tool, which is called KIT. And KIT relies on AI, machine learning, and computational thinking to basically tell people if the information they're writing is accurate or not. So imagine Grammarly, but instead of checking the grammar aspects of your text, KIT is going to check the accuracy of the information you're writing.
So on our developing this tool, Check It, there have been 5 key different checkpoints, if you will, along the way, and we would like to outline some of these for you today. So number 1 would be our Number 1 would be our part of being in the Ascend program of School of Humanity. Now, this was really the bedrock of how our solution developed and actually became how it is today. We both took part in the Future of Medicine pathway, and I guess at the start we kind of had different ideas of where we wanted to go, but then we both realized that misinformation, and more specifically medical misinformation, was something that we decided that we wanted to tackle. And thus through the Ascend program, we then went off into our respective skill paths. I went on to data analysis and Rafael went into coding. And from this, we managed to kind of bring our skills together in order to create the solution possible.
So the second stage was investigation and analysis. Now, it's important to mention that because we were in the Future of Medicine, skill path and pathway, like our first intention was not to make this about misinformation in general. It was just about health misinformation, medical misinformation. So the mind maps, the graphics I'm going to show next, they're about that initial phase of the process. Of course, then later we did it again in a more broader perspective, but now we're going to be seeing this. So one of the investigation and analysis steps we went through was root cause analysis. This is an example of a why diagram. So we start with one simple sentence: misinformation circulates and spreads fast. And then from here, we're going to ask why. Why does this happen? And we're going to put out as many reasons as we can think of. And we're going to be consequently asking why. And this hopefully will help us to get to the root cause of the problem we are tackling. Then we also did a systems analysis, because misinformation is a problem that affects several areas and it's provoked by several areas. For example, by the algorithms on social media that we all know about, or by the lack of digital literacy, or even by our own minds that find way more attractive information that is just straightforward instead of accurate. Of course, sometimes information can be straightforward and accurate, but accurate, but that's not usually the case, which is why misinformation is so appealing to us. Then we analyze the stakeholders. So who is affected by health misinformation and who benefits from it? And obviously who is affected is pretty straightforward. The patients, the doctors, hospitals, pharmaceutical companies, and every healthcare professional, or even the families of the patients. Imagine someone who has just been diagnosed with cancer and they go online looking for information, and that's completely fine. It's normal. They're just curious about it. And then they find this clinic that advertises for a successful treatment using ginger instead of chemotherapy. And they are aware of the dangers of chemotherapy, so they decide, why not give it a go? And with this, they can be putting off treatments that can potentially be life-saving. On the other side, we have social media companies and other companies that profit from selling items that prey on people's belief in information. Also have certain political groups that profit from undermining the authority of the current government. And also the people who produce misinformation for money and fame, basically. So after all of this root cause and system analysis, we were finally going to have to work on our solution. And this is basically a plan of what we had to do. We decided we wanted to create a validation method for medical information. And for this, we mapped out what skills we would need, what were the resources, how it would work, and why did we want to do it? What system and root cause problems it tackles, what was its purpose, and the people and organizations that it involved.
So after laying out the different ways that we wanted to approach this problem and kind of coming to a consensus on how we wanted to produce it, we then had to prototype it. Now, this was definitely the part that took us the longest, but I would definitely say it was the most fulfilling. It was so incredible to actually see our solution come from just kind of some ideas on a mind map to actually being a physical product that people could use. So we decided that we wanted to put our validation system on a website. We actually did a survey and we found that 97% of people would actually prefer it to be a website over an app, which we found quite interesting. And yes, and our website contains lots of different other resources that people can use and access, not just the algorithm, which Rafael will go over shortly, but it has tips and tricks in order for people to find the most trustful information, and also a bank of links that can take them to more trustful information. For example, the UN, the CDC, or the NHS.
So now we're going to be talking about the technical sides of our solution. We call it here Kit Junior because it's technically the first version of Kit. So this is a very simple pseudocode that kind of shows like a chart that shows how the algorithm would work. So the input would be a keyword and an article or piece of written information. And these keyword lists, they are basically lists of words that are very associated with misinformation, such as, for example, vaccines cause autism. So what the algorithm is going to do is going to analyze the information. And if it finds these three keywords, for example, here, it's going to flag it as orange. This is what we hope it is a pretty straightforward color code where green is for information that we can probably trust and red is for information that we should not trust at all.
Okay, so number 4 is reiteration. So once we actually developed our algorithm, we wanted to test it out and see see how we could branch out and maybe access other opportunities. One of these other opportunities was the Be a Pirate Challenge. So the Be a Pirate Challenge is a challenge made by the Moonshot Pirates, and it's really trying to get youths to be innovative and kind of act upon their desires to make the world a better place. We were actually a finalist in this challenge, which was a great honor, and it really showed that our solution had promise, and that I guess it was accessible and needed in the world, which was great.
It was also in the Be a Pirate Challenge that we decided to make our solution more broader, not just about health misinformation, but about every kind of misinformation. And to do this, we had to make a few changes in our algorithm. And this is why. I'm going to talk about the tool we have now. So in the pseudocode I showed you earlier, there is a problem in here, which is the keyword list. Originally we did this by reading through hundreds of articles, of social media posts, of comments, peer reviews, and we would by hand just take words out of that and put them into keyword lists. And we made like, I don't know, like about 60 lists with keywords, but that is very exhausting and it's prone to human error, you know? So we decided to create an algorithm that would rely on machine learning and AI to create those keyword lists. And in here, what we would use as an input would be written tests and the comments and peer reviews and semantic similarity. So this algorithm wouldn't exactly be analyzing the text itself, but the comments and the reviews that it had. And you would do this by semantic similarity. And if the feedback was positive, so if the comments were positive and they were agreeing with that information, the algorithm is going to stop because it's not going to consider it misinformation. If they're negative and people do not agree with what is said in there, it's going to continue. And it's going to analyze if it has words with 4 more letters repeated. So that we avoid words repeated, such as connectors. Like a lot of times we have ands or pronouns repeated a lot, and we don't care about that. So if it doesn't have word repeated, it's also going to be not considered misinformation. If it does, we're going to see if these words are in the same semantic context. And if they do, the output would be a list of words in the same semantic context. Now, we're going to get these different lists of words in the same semantic context, and we're going to use semantic similarity again. And we're going to use this to analyze the list of words. And we're going to see if there are words in different lists that are in the same semantic context. If they're not, we just get those lists of words in the same semantic context, and they become a list of keywords. If they are, we're going to see if there are words repeated. If they're not, again, we just get those words and they make a list of keywords. If they are, we're going to eliminate the copies and then we get another list of keywords. So this is a very simple algorithm that allows us to very easily just get tons of lists of keywords that we don't have to do them by hand.
So our final kind of process in kind of the current development of our solution is partners. Now this, I guess, solution is very technical and it requires a lot of different expertise. And so we kind of have different lists of people that we would like to link up with and work with hopefully in the future. So some of these include people who have experience in machine learning, coding, AI, and web development, because I kind of guess at the moment we've kind of got some very basic ideas on these, but we definitely want to expand our horizons and make this solution as accessible and usable as possible.
So what's next? As Tom was talking about partners, Check-It is a team effort and we want to keep it that way. And besides, we're just kids. We don't really have most of the skills that this solution requires to become a reality. Then we want to build an MVP to finally get our idea running. And looking back in that part of the initial part of awareness and education, we also want to create bootcamps because, again, the greatest weapon is knowledge. So we want to teach people about misinformation and why it is a problem. Thank you so much for listening to us and for this opportunity. Here are our contacts. Don't hesitate to reach out to us if you have any questions.
That was brilliant, Tom and Rafa. Thank you. That was amazing. So I wonder if anybody has any questions for Tom and Rafa before we move on to the next presentation.
I'd like to make a question, Claire.
Please.
First of all, congratulations. For a moment, I was doubting if you were students or you were actually like mentors or professors. So excellent presentation. My question is, what motivated you to choose like this challenge or this track for your project?
So I can answer this. For me, so I live in a country which is Portugal, and especially in more interior countrysides, it's not very developed, and people still believe a lot in like traditional medicine. So they believe more in the ointments and the cultural things that exist than in actually going to the doctors. And while that works sometimes, and I'm not saying that it doesn't, for some people it does, these people, especially older people, they were just refusing to see a doctor for any kind of reason. And I see that in my family. My grandpa, he's very sick and he always refuses to go to the doctors because he just says that, oh no, if I go there, I'll get even sicker, because there's just no trust in the healthcare system. And that for me was a very personal topic, and that's why I decided to choose this topic.
And I guess for me, so when I first started the future medicine path, I kind of wanted to go down the ethics of medicine. I wanted to see kind of how maybe the future developments in biotechnology would maybe question our kind of ethical standards that we have. But then obviously the invasion of Ukraine by Russia, that kind of threw a spanner in the works, because then I started to see a lot of information on Instagram and on Twitter, a lot of information which I knew in my heart and kind of other sources debunked. That information was not true. And I realized that the pace that misinformation can spread is just incredible. And I knew it was something that then I wanted to tackle, because then I could still implement some of the more ethical concerns into it. And yeah, I kind of realized that it would be a good all-encompassing topic to tackle, and you could come from it from lots of different angles.
All right, thanks for your answers. I mean, excellent. And you mentioned that you may be like lacking some skills. My diagnosis is that you exceed the intended skills, because this was not about, about the coding and about all of that. Your critical thinking, your project planning and project development skills, and your presenting skills. I mean, they are awesome. This is a great project, and I wanted to keep contact with Claire, like to see if we can be of any aid in this process if you choose to continue this project.
Thank you so much.
It's a project I would love to see like out there, Awesome. Congratulations. Thank you.
Thanks, Arturo. And well done again to Thomas and Rafael.